Good morning. Welcome. Thank you for coming to the second PAM Summit. My name is Steve Smelski. My wife Shelley and I would like to welcome you all here, and for those who attended last year, welcome back, and for those that didn't attend last year, thank you for coming. We're very excited about this second PAM Summit. We have a lot of good information to share with everybody. We've got a very good story to talk about, and we're going to talk about other things that we're going to work on as we go forward. We've got a full schedule. Ms. Donna Walsh will be up here in a few minutes and go through the schedule. We've got a jam-packed day today. We've got 3 breakout sessions. But first, I'd like to thank Florida Hospital for Children, the Seminole County Health Department, and the Orange County Health Department for all of the support that they've given us to actually get to this point for this event. We couldn't have done it without them, and actually, I'd like to thank them for helping us out. We've brought back almost all of the experts that we had last year, and you're going to hear from many of them. Some of them will be leading the breakout sessions. You'll have a choice to go to those. But first of all, I'd like to introduce you to Wendy Sullivan. She works for Florida Hospital. She's the Director for Network Strategic Planning. Thank you.
Good morning. On behalf of Florida Hospital for Children, we welcome you to the second annual PAM conference, and what a year it's been. You know, last year when we put this on, we didn't really understand the impact of what it would make to the children of Central Florida, and you'll find that today. This is in conjunction with the Smelski Foundation and the Florida Department of Health. Florida Hospital for Children is a 200-bed children's hospital that services the lives of children up and down the state. We take care of children from Brevard to Sebring to Flagler. Up and down, we really treat the lives of children, and you'll find that through the expertise of our physicians and the partnerships in the community, we're really making difference in the lives of all these children in Central Florida. I would like to welcome our Chief Medical Officer, Rajan Wadhawan. Prior to joining Florida Hospital for Children 5 years ago, it's hard to believe it's only been 5 years, he was the Director of Clinical Research at All Children's Hospital in St. Pete. He's our Chief Medical Officer and our Medical Director for Neonatology Services at Florida Hospital for Children. Please welcome Raj.
Thank you, Wendy. And I also want to extend my welcome to you all to be here today at the second annual PAM Summit. I know some of our speakers have traveled from far, so we certainly appreciate them being here because this conference would not be a success without all the experts in the room that are there. You just heard from Mr. Smelski, and this is really a partnership with the Jordan Smelski Foundation. This all came about, I met them first time was about 3 years ago. And this was at a very difficult circumstance of us having just lost Jordan to this very disease that we're talking about today. And my heart certainly went out to them. I wanted to do whatever I could do to help them at that time. I never met Jordan. I'm a neonatologist, didn't take care of Jordan myself, but I could certainly feel their pain. And I could also see the passion that Shelley and Steve brought this, and they had a lot of questions at that time about the disease. I think they have learned almost there is anything to know about PAM now. I know that for sure, but they were asking a lot of questions. What is this? What can we do to make sure that no child ever goes through that again? And they certainly have made that their life's mission. I see it every day. And they asked me if we would be willing to partner with them, and I said, of course, this is a very noble cause. That's why we exist as a children's hospital, because we want to stamp out children's diseases and help any child that we can. And where we are today is really a result of that partnership. And we are privileged to partner with them to bring together awareness for this condition and hopefully continue to advance the treatment and research. That's the goal. Everybody in the room is probably already aware of Sebastian de Leon's story. It was in the press all over. If you're not, you're going to learn about it today. This young man from South Florida presented to our emergency department while vacationing here with his family with signs and symptoms of meningitis. And in my mind, if there is an ideal treatment as we know it for PAM today, I think Sebastian got it. And that really was a result of this education and partnership, I believe, that we were able to get the treatment that we could provide to Sebastian that helped him to near full recovery. Right from him presenting to the ER, getting a timely lumbar puncture, to our medical technologist being aware of looking for negularia in the CSF when she saw it. She picked it up right away. Timely call to the ER, activation of the ICU team. Dr. Liriano, who was an intensivist, whom you're going to get to meet in a few minutes, he was well familiar with the medical management of this condition, to having timely access to the drug. And actually, a lot of people played a role in that, including Wendy Sullivan, who was just here. She was the administrator on call that day. And she made phone calls and met with the person who brought over the medication from the manufacturer at the hospital front entrance and walked it personally to the ICU. So all of this was very satisfying that we were able to make a difference for a child's outcome. And it's certainly a success story that we all hope for. And we hope that any time there is another child who develops this dreaded condition, this story is repeated, whether it is here or somewhere else. And that is the goal for educational conferences like today, is to create awareness, think about what we can do as medical community for timely and early diagnosis, what sort of alerting mechanism can we put into place that may make people think about this kind of a condition, which none of us see on an everyday basis, fortunately. But when we are faced with it, how do we pick it up in the quickest fashion? And we've done some work around that, but there's a lot more that needs to be done. We have developed an order sentence within our CSF ordering pathway. When you order an LP, there is a question that you ask, that is there a freshwater exposure? One, it makes a physician think when it's face up and you're looking at it as you're ordering CSF. And secondly, it certainly alerts the lab that here's a potential of negularia, and maybe we should be extra careful when we're looking at the sample. There are other thoughts about what we can do, whether we should be asking the question at the front entrance of the ER, at the triage nurse level. If a patient shows up with signs and symptoms of headache and fever, should we be asking this question at the front desk? We haven't done that yet, but I think that is certainly possible. And also developing care pathway where a patient presents with negularia once you diagnose, what should happen, laying out the care pathway. And this is another idea from one of our physicians, Dr. Herrera, sitting in here. He was talking to me yesterday. He says, why don't we do that? We do that for many other conditions. This may not be as common as sepsis or myocardial infarction or stroke, but we have pathways for those. Why don't we have one for this? So that's something that we're hoping to work with, along with our ID colleagues in ICU, to continue to improve the care. So, and I also know, I don't want to take up too much time, but I know we have an excellent lineup of great and very knowledgeable speakers, and I hope you will find the day very educational and useful. Thank you. Sorry, I was also supposed to introduce somebody. I'm thinking, okay, who's next? I am sorry. So I was carried away, got thinking about what we need to do next for this. I wanted to welcome Ms. Donna Walsh. She's the acting health officer for the Florida Department of Health for Seminole County. She's going to come over and get the program started. Thank you, Donna.
Good morning, everyone. Well, I don't have to say too much. Dr. Wadhawan actually gave you the outline of the day, which is amazing. But I do want to say that it's been an absolute pleasure to work with Florida Hospital for Children and Steve and Shelley Smelski and the Smelski Foundation in raising awareness about the risk of exposure to amoebas and preventing PAM, not only here locally in Central Florida, but actually there's been a number of initiatives through their foundation and through public health on a national level to prevent PAM. And so you all have programs, and we do have a little bit of a change, as Dr. Wadhawan mentioned. In addition to our keynote speakers, we're also going to have, we have the privilege of having Dr. Liriano join us and talk about Sebastian's case. And so it'll be definitely very interesting and very meaningful for all of us. Just a little bit about the breakout sessions after the keynote speakers this morning, and a little break. We will have breakout sessions, and you will have the option to go to one of three. Each of these sessions will be recorded. So, and if you do miss one, and feel like, well, I really wanted to go up to all three, you'll be able to view them online. You'll also get a glimpse of what each session talked about when we gather after lunch and talk about the key points that were discussed in each of the sessions and also actions moving forward. So we are blessed to have the speakers return this year, I think all but one, and then we have many more who also joined us. So this will definitely be a very educational as well as meaningful summit for everyone. I would like to, at this point, introduce Dr. Kevin Sherin, who is the health officer for the Florida Department of Health in Orange County, and he's going to talk to us a little bit about what public health has done over the years. And we were just discussing before the summit that, public health has been putting out the educational messages, since the 60s and maybe before. Central Florida in particular, because we have had a number of cases here over the years. And Dr. Sherin's been instrumental in making some changes throughout the nation that will help raise awareness, once again, not only amongst public health practitioners, but also clinicians. So with that, Dr. Sherin.
Good morning and welcome to Orange County, Florida, also known as the House of the Mouse. And on behalf of the Florida Department of Health, Donna and I both want to welcome you to this second annual symposium on Naegleria, the deadly amoeba. And we want to thank Shelley and Steve and the Foundation and Florida Hospital for Children for sponsoring this event. What's truly unique here is the partnership that's developed and the location in which it's happened for several reasons. Shelley and Steve have been a unique couple. They took the pain and the grief of losing Jordan and transformed it into a foundation that's going to continue to do good in the years to come. And you can see that in just this past year, since the last annual summit, the first annual summit, so much has happened. The story of Sebastian is absolutely compelling, and you'll be moved by what has happened here at Florida Hospital in the last few weeks. But the story goes way back to 1962 as far as the United States, and it began here in Orlando, and the first case of Naegleria was diagnosed at Orlando Health, today it's called, but it was called Orange Memorial Hospital. And we truly are the epicenter, I'm using a public health term, for Naegleria in the United States. Orange County, Florida has had 16 cases among residents of this county, and that's more than any county in the United States. So we're not a stranger to this disease. And yes, we've accomplished a lot in the last year, and I can tell you about some things that have happened also from the public health standpoint. But I'd like to have us look at a challenge, which is to develop a Center for Clinical Excellence. I think what's happened here at Florida Hospital, and as a result of the summit from last year and the experts that we've brought together, there's no reason that we can't become the Center for Clinical Excellence on this disease in the United States. What do you think of that idea? Now, when I was the health officer here 8 years ago, and I had a gap where I went to California for a couple of years, but we had 3 children who died here in Orlando. 2 were from Orange County, and 1 was from a neighboring county, Osceola County. And I'll never forget that, because as a physician, I felt helpless. I've worked in children's hospitals in my career, and I've had the worst case of my life is when an adolescent child died, to be honest. That was a question I was asked in my interview for the job in Orange County. What was the toughest case that you ever had? And it was losing an adolescent child on a disease where there was no treatment. There was nothing we could do to reverse the course. So we grieve when these things happen. We physicians grieve with the parents. We grieve with the families. And this brought it all back last year to be at this summit. And I vowed to several of the physicians in the group that I would do something. So I wrote a letter to the American Family Physician, and Dr. Jett and I published that. And that went to 186,000 physicians in the United States. It's probably one of the most widely read publications in medicine. And it told what to do. It told the best practices. It told about contacting Dr. Cope in her lab and how to get the miltefosine to children in need. So the information went out across the United States. Through another organization that I'm a past president of, we passed a resolution with the American Medical Association, and it's now AMA policy in the United States to educate physicians on this topic. And they said it couldn't be done, that it was too rare a disease. We're doing the same thing in Florida. We produced a webinar which went to the Seminole County Medical Society and the Orange County Medical Society, and it may end up with the Florida College of Emergency Physicians and hopefully the FMA to raise physician awareness. We're hoping the AMA will look at this as well. So when they tell you it's too rare and we can't do anything about it, we know differently here in Orlando. The Council of State and Territorial Epidemiologists met in Anchorage, Alaska, in June. They considered national notifiability in their meeting, and one lone person shot it down. It was going to pass. So that will come up again, because this disease is now popping up in states all across the United States. The latest information is coming from the state of Maryland. It's happened in North Carolina, South Carolina, Texas, and it involved an Ohio child and a New York child in several of those other states. So just this summer, other children have died. We do not want to see any more children die of this disease. The Gump family, who lost a child in Polk County, has a Move On petition to ensure that national notifiability goes forward with the Council of State and Territorial Epidemiologists. That's what the world of public health can do, notifiable diseases and reporting. We want to see these accomplished the next time we meet. So we want to see national awareness increased, we want to see national notifiability go forward, and those are some of the challenges before us.